E-health can help improve access to care and quality of care delivered, and it can cut cost. This is the key message from the Med-e-Tel conference and the IHE Connectathon 2015 here in Luxembourg.
I wish you a successful, enjoyable meeting, all of you. And let's not forget that it's for the ultimate benefit of patients and citizens all over the world.
Attending from 51 countries around the globe. And since I'm Swiss, grüezi to Med-e-Tel.
The potential is huge. E-health systems are needed and worth it because they can support the doctors, nurses and other healthcare providers who are dedicated to our health system.
Luxembourg has most recently turned its focus on first-class infrastructure and telecommunication networks.
350 delegates came to the Congress in the Grand Duchy to discuss major trends in electronic health records, chronic care management and IT-supported collaboration care with their peers and with policymakers. And 300 techies tested the interoperability of their systems against other software solutions.
Interoperability has a big cost, we all know it, but we will have an even greater cost if we don't do it, because we have to be interconnected with all the stakeholders. We have to interconnect the patients' records, and if we don't do it, we cannot give the patients the security and the protection they need for their data. This is, to my eyes, very important to assure.
IT systems need to talk to one another to allow for the flow of information which enables actors in the care chain to interact. Standards, which are at the core of interoperability, play an important role in this context. They reduce risks in the information flow and they cut efforts required for the creation of interfaces. Solutions which comply with standards make IT investments future-safe by adding flexibility for modifications and extensions, as well as for migration. In the context of these goals, integrating the healthcare enterprise, IHE, is an organization which integrates standards into profiles for multiple fields of application in hospitals and beyond.
I would say 15 countries are doing IHE around the world. At the national or at the regional level, at least 2 or 3 regions. So that's significant now.
We do have a good integration now inside radiology departments. We do need communication of images and reports throughout enterprises to improve the quality of service for patients.
The profiles describe what standard communication systems can be used and how we can integrate them to create profiles that solve real-life solutions in hospitals and in regions where hospitals want to change documents, images, etc., patient information in between hospitals.
IHE started really as a way of trying to break down barriers between systems in healthcare. Radiologists were particularly frustrated at not being able to get lab values and not being able to share images across systems within a healthcare environment.
IHE is a very comprehensive organization, has 2 major activities around the world. First of all, it's a development activities, so that we have domains where we develop technical specification. Those domains are under the umbrella of IHE International, which is a not-for-profit organization, standard development organization, based in the United States, which coordinates all the activities around the world.
This is giving a lot of confidence to the participants, also the vendors and the users that support the connectors, because it's a community testing event. So we both have vendors that are testing, but also association and end user association that are participating as monitors.
This project has a good opportunity to assessing the possibility of changing clinical data between the 2 sides of the ocean. And from a user point of view, this could be very important also for our businessmen and tourists coming to Europe, to Italy, to Milano.
We have completed the testing part, the implementation, and we also performed some demonstration. The last one last week in Chicago, and we had a very enthusiastic result from this project.
It's absolutely a key issue, interoperability. The very critical phases in a hospital is when a patient moves from a ward to another ward, or when the patient is discharged and goes to the community, and also when a patient comes from the community to the hospital. Every time there is a junction, there is an interface, and it's very, very critical.
The suppliers ask for evidence of the images they've created or the messages that they've sent, check that they conform to what the documents say they should, and that one system can see the same information as the other system. It's a very good company here, and nice to work with very knowledgeable people. It's given me a lot of chance to learn myself, so yes, I'm really enjoying it.
Well, the big advantage of IHE and what it's brought is further standardisation and specification of how systems from different vendors can work together to be able to pass information safely and efficiently from one system to another.
With the testing of the standards, the interoperability is somewhat put on a level playing field with other vendors, so that when you do invest into a product that does the standards that IHE has profiled, the replacement, the add-ons of other systems to that infrastructure, IT infrastructure, is much more easily maintained.
It's a fantastic event. It's the third time we've been here as a company. It's the closeness of working together with all the different companies, the people. You meet real problems here that you wouldn't see in normal testing done in an office, at home. Here you experience real problems, you have to solve them. You get to meet everybody that you and we will be working with in the future as we move into Europe and wider markets. And it builds a great bond.
We tend to integrate with all the various modalities from all the vendors that are here. This is a very unique opportunity for us to see new modalities that are about to appear on the market, and also some of the more unusual ones, such as the resting ECG, some of the breast tomography scanners, some of the eye scanners, the fundal imaging for eyes, etc. So some of the more unusual devices we get to see here, and we get to see them all in one place. So this gives us a very unique opportunity to test all of these systems in one place without having to travel between different hospitals and different customers and find problems out in the field.
The Grand Duchy is the perfect setting to choose for these events. Its government is convinced of the added value of information and communication technology services for its citizens, and it is dedicated to developing Luxembourg into a hub for IT and communications, with e-health playing a major role. The recent creation of the agency e-Santé is considered an important step forward in catalyzing activities in this context.
Les standards sont très importants. Le Luxembourg est dans un contexte transfrontalier, cross-border très important, avec une communauté belge, française et allemande qui est pas négligeable, puisque c'est pratiquement 160 000 personnes tous les jours qui franchissent la frontière.
IHE is mainly being used as a way to kind of focus the project in a way that the industry who will be developing those new solutions, they do not need to deal with all the interfaces that are exchanging data.
More dialogue, more education, use of new technologies, raise awareness among the young generations that there is equal interest for healthcare for men and women.
We first need to have a good electronic record system, and then to implement the part that the patient can actually control, consult, provide data in order to track their diseases.
Durch Technologie haben wir heutzutage ganz andere Möglichkeiten, uns im Gesundheitswesen zu vernetzen. Dadurch haben wir Möglichkeiten, die Qualität zu verbessern, im Hinblick auf die Datenqualität zum Beispiel, durch Strukturierung der Daten, aber eben auch durch den Austausch der Daten. Dadurch können wir ganz andere Workflows etablieren, haben weniger Medienbrüche, beziehungsweise im Idealfall überhaupt keine Medienbrüche mehr. Und das ermöglicht natürlich auch für die Leistungserbringer einen ganz anderen Zugang zu den Daten.
The stakeholders have an opinion what kind of value they want to have from it, and that's where they actually sit together and say, I would like this from this certain product of this service.
there is huge potentiality for healthcare professionals to use social media. It can start from medical education, and it can go through information dissemination, collaboration between peers, but also information to patients.
Cardiologists are aware that the way they do their practice now will dramatically change in the near future because of all the e-health applications and
knowledge and acceptance of e-health and telemedicine. Telemedicine as such is not a discipline, it's an instrument, and the acceptance of this instrument is still a problem that it's not always accepted around the globe, within professionals but also within customers or patients.
Well, the highlights of this year's event are around interoperability of mHealth and eHealth systems, around smart technologies for independent living and aging well, around women in eHealth and how they can advance education around those topics.
Next year, the IHE Connectathon will come to Bochum in Germany.
Bochum ist natürlich ein Heimspiel für uns. Da werden wir mit dem Fahrrad hinfahren und freuen uns ganz besonders darauf, dass wir direkt vor der Auftür so ein Ereignis haben.
Med-e-Tel will again bring together in Luxembourg key stakeholders in e-health at an international level.